Welcome to Know Happiness, a podcast around how we seek, find, and sustain happiness in some of the most unusual places. Today, I have a very special guest, Dr. Shawn Lillig.
We can't forget the doctor.
No. So welcome. Thank you for joining us.
Thanks so much for having me. I'm so excited to be talking about these subjects. Rarely do we get an opportunity to talk about happiness and alternative states of consciousness in kind of a public forum. So I'm really excited about that.
Well, and that's kind of what got me started on this journey, was that I had been blessed and given all of these insights around, spirituality and healing. And so I just felt like I don't have a choice but to not share it. I have to share it.
Following your calling, baby.
Yeah.
Okay, you got to follow the message. If not, it finds somebody else.
Right.
Too. Okay.
So just give me a brief background about you.
Who I am, okay, my titles, okay. First off, I'm a father, okay. I have 2 daughters, and that's my primary role in life. I'm also a physician, I'm also a student and a teacher. I'm also the head yoga floor sweeper at the yoga pad at Bonner Springs Integrative Health. I'm also a facilitator of alternative states and a family medicine board certified physician. I trained at the University of Kansas undergraduate and medical school. I attended residency and internship at University of Missouri, Kansas City in Truman residency. I've attended a University of Arizona integrative medicine in residency program. I've also had postgraduate training from the California Institute of Integral Studies. I've also had postgraduate training from Colorado's Prati Institute, a Psychedelic Research and Training Institute, as well as Rick Doplin's MAPS Institute. I have all the institutes, all the universities, especially when it comes to alternative states of consciousness. It's really my area.
Wow, that's amazing. You don't seem that old either. So
I just turned 40. I'm feeling the age. Okay, I turned 40 a few days after coming back from India. Gotcha. So I had this worldwide expanse, and I turned 40, and my gosh, my body hurts. I didn't expect it to hurt. I didn't expect that after turning a certain age. I know biologically it's not supposed to happen that way. I could ask a doctor, but I know it's not supposed to happen. The last, a couple weeks has been really rough on me.
Yeah, I feel that. I wasn't all that upset about turning 40, but 45 was a hard one for me, because that's like midway to 50.
Well, when you get there, let me know.
Yeah.
How it goes. Okay, so.
Thanks for joining us. This is amazing. I cannot wait to dive into all these different topics.
Yeah.
But you just opened your own practice. Is that not correct?
Yeah, I just opened my own direct primary care practice. So I've been in different models. Of course, the hospital-based system, University of Kansas, Truman Medical Center, big, large institutions in our Kansas City metropolitan area. I've also went directly into private practice, where I had a physician-owned group and worked with Sunflower Medical Group for 6.5 years, being a partner and owner of a health system. Okay, and now came back to my own direct primary care practice. This is my baby. It's the future of medicine. It's where we're all headed. It's intensive, it's personalized care. It's where we're all headed for healthcare in the future. The insurance-based corporate system is no longer going to be surviving over the next couple of years, is what we'll find out. And we still need hospitals. We still need specialists. We still need procedures. We had the world's finest procedures, okay? But what's lacking is our primary care. So we're going to see a different model taking over with direct primary care. It's about the patient again, not about the insurance company, the pharmaceuticals, and the whole system.
Yeah, because that whole system is really broken as far as I'm concerned.
Do you want to talk about the system?
Yeah.
Okay.
Well, as expensive as, we're paying more than anywhere else, and we're sicker.
Yeah, the data's everywhere, okay? The data's everywhere when it comes about poor outcomes, maternal fetal mortality, depression, life expectancy, length of hospitalization stay, cost expenses. It's all there. We're not doing so great for spending 2 to 3 times as much as the other countries are who have centralized health plans. And if we want to trace the history of this, okay, there's a long history of healthcare, and really it comes down to how we view our responsibilities for illness and death and infirmity, and what our relationships are to take care of other people. But most recently, let's say after 2000, the biggest, most significant event was the 2008 Obamacare plan, okay? And it was a big deal. Somebody was a medical student at the time, and it was a really important time because we were talking about, what does healthcare mean? What does access to healthcare mean? How do we pay for these things? And what do we deserve in this system? The other thing that was going on in 2008 was a huge economic recession, okay?
Right.
And this is what's important to remember what's going on with these decisions in time, okay? In 2008, housing crash, okay? The banks were under, okay? Massive unemployment, and every single politician was skirting the line between a 19.9% recession and a 20.1% depression. Right. Okay, yeah. And so we didn't want to worsen this economic scenario. So we had this bill passed. We have access to a unified payer, a central payer, okay? Through the Obamacare, we have mandated care, okay? And then at the very last moment in 2008, we said, you know what? We're in the middle of recession. All these privately insured companies, all these people who work for the private insurance companies total 3 to 4 million people. If we cut private insurers right now, we're going to lose 3 to 4 million jobs in the middle of a severe recession, and it's going to worsen and it'd be cataclysmic. So here we are, almost 2 decades later, and we never fixed it. Okay, we never fixed it, and I dare to say I don't think we are going to fix it. I don't think it's in the point of where we can fix that program anymore. So 2008 happened. We decided that temporarily it wasn't worth it economically, and we're still paying for that recessionary decision making right now.
Right. Interesting. Can you explain the difference between a direct primary care clinic or practice? Like what are the difference between your standard, normal?
I think the first thing we talk about that is what the difference between primary care and health care is versus health insurance. Okay, I think a lot of this time we have a conversation in the United States and we intermix the two, pretending that Blue Cross, Blue Shield, Medicare, Medicaid, all these payer systems and access to care and our premiums that we pay are the same thing as a healthcare delivery system. A healthcare delivery system has medical providers in it, okay? It has nurses and doctors and pharmacists who are trying to help you out. They are taking on disease and addressing infirmity, addressing your concerns, and trying to help, okay? That's the healthcare system and how we deliver health. Then there's health insurance, which is the mechanism of paying for everything. And we get everything bottled up. Here we are concentrating on our $500 or $600 a month premiums, okay, which guarantee us nothing, access to nothing, access to a $9,000 deductible, okay, right? If I want it, okay? So I have to be $20,000 into my plan before it even starts kicking in. That's nonsense, okay? And it's not health care. It's a mechanism. It's an insurance program. It's a derivative-based program that people trade stocks on, okay? It is not actually healthcare delivery. So we start to get into direct primary care versus traditional primary care. Regular primary care has quick office visits, 15 minutes. Maybe you know your provider, maybe you don't. Maybe you wait 3 months, maybe you don't. In and out, maybe 2 to 3 minutes interaction, documentation, co-pays, waiting in line, so on and so forth, okay? Direct primary care is a personalized individual plan with your physician who you know, love, and trust, okay? So when I sit down with people, I sit down for the first time for an hour. We review their records, we review all their medicines, we review their goals, we review their spirituality, their emotional thoughts, where they're at, what they want to do with their life.
What they're eating.
What they're eating.
Yeah.
Okay, can we talk about what people are eating? Can we talk about what you're doing for exercise?
Right.
Okay? These aren't things that come into the regular Western system. Now, I've been doing 13 years of family medicine now, okay? And I have done every single visit possible. I can tell you the incentives that there are in our current system to move faster, to care less, to prescribe more pills, and to counsel less, okay? But I am moving away from that. It's successful. I love it. I get to deliver individualized, personalized care. And for me, with my program, it's 1/4 the cost of health insurance on a monthly basis, and you have infinite access to me.
Right.
I think that's worth it. If you want to text, call, message me.
For sure. Well, I've been doing direct care for, 5, 6, 7 years now, where I just pay my doctor. And it's wonderful because I could be like, I'm kind of getting a sore throat, what can you maybe, it's just, it's like a boutique doctor type situation. And it should be.
There are different levels of thought processes, okay? Let's say we're in Mexico and you have an ear infection, okay? You go to the pharmacy and you just buy the antibiotic yourself. These are not massive thought processes. So if you have an ear infection and it's been going on for 6 days and it hurts real bad, okay, and you're getting ready to go on a plane, by golly, how do you get access to an antibiotic so you can start to feel better? You shouldn't have to wait 2 weeks, okay, to get in. Your ear's already burst by then, okay? You shouldn't have to pay hundreds or thousands of dollars for this. I mean, it should just be available, okay? In other countries, it's easily available. Access to healthcare. It's not about cost. It's not about the quality of it. It's about access. It doesn't matter how great if you have the world's finest Super Bowl champion knee replacement surgeon. If you're never going to see that surgeon, if you're never going to see her, it doesn't matter. Okay, so if we don't actually have access to our systems and we can't afford it, then it's essentially useless. The other thing I do with my direct primary care, and that's different maybe from other direct primary cares, is I have yoga involved with it. We have nutrition, counseling, and we have some different health plan. We have a community center, that we can kind of bring people in for exercise. We do lots of events. We're throwing yoga festivals, community-based events where we're singing songs and drinking cacao. So it's kind of a community feel to it too. So I really enjoy that myself.
And you just opened this, correct? Like a couple months ago?
Yeah. I just opened it up, and it's so beautiful when you don't have the pressures of having to make money in a certain way, patient quotas, treatment directives. I don't have to follow a hospital protocol or a hospital system about how they treat patients. I do exactly what I want to do, and what I do is whatever is best for the patient. Which
is wonderful, because like I'm supposed to get an MRI, and the insurance company is forcing me to take another a sonogram before I do it, even though it wouldn't be able to tell me that that's what was wrong anyway. So
the reason why is because an MRI costs $2,000 to $3,000, depending on your use of contrast, and an ultrasound costs $200 to $300. They also know that if they frustrate you, they piss you off, they make it seem like you can never get access to healthcare, they win.
Well, yeah, because I'm like, forget it.
So let's go back to this whole idea: health insurance versus health care. Well, health insurance is not necessarily bad. People who work at United Health are not necessarily bad. They're probably in the Cub Scouts right next door to you. They're working a job. We developed a system to pay for healthcare, and these people are doing their job by denying coverage and not paying people appropriately. They deny care. That's the business model, to pay for things as little as possible, as much as possible, and deny care. That generates a profit. If they're not trying to deny care, they're not doing a job for their shareholders. They're doing a bad corporate job, okay? The real question is, why do we have these insurance companies that are for profit and profit off patients and patient interactions? Why do we decide that this is our mechanism for providing healthcare payments? Why?
Right. Well, that's a good question. And, I think that the Western medicine has turned so much into like, here's a pill, here's a script, and then, I'm having these side effects, so here's another script. And it's like, I don't see how people don't see this incestuous like relationship with the pharmaceutical company and even I think I just read that like the all the major pharmacies are owned by
PBMs. Oh my gosh,
yeah.
PBMs. Yeah, pharmaceutical companies. Yeah, they provide kickbacks to each other. If I provide a kickback, I'm an orange. Okay, if I provide a kickback to myself, a doctor ever does that, oh my gosh, you are found so quickly. You can't charge different rates for your real estate. You can't hold certain medicines to your practice. You can't refer. You have to watch your referral patterns. Every single thing I do as a provider has to be completely excluded from money. But not the insurance companies.
Right.
No. They got a pat on the back. Yeah. I need more lobbyists.
Yeah.
Okay. For me, okay? The patients need more lobbyists, okay? They're not held accountable for their legal actions. In fact, they're doing their job, okay? Let's recognize what it is. An insurance company is doing their job by providing horrible service. That's exactly what we designed it to do, okay? They're being profitable. They're taking care of their shareholders. The employees there are generating a profit for their company, which pays their bills and pays their mortgage, okay? The problem is the system's wrong, and we are accepting it. We don't have to.
Right. So that makes me wonder how you kind of branched off. When did you decide, hey, I think what's currently going on is not for me any longer? What was the switch?
I was sitting in my office one day with patients who couldn't schedule. Okay, a pharmacy I couldn't get a hold of, okay, a nurse that was gone that day, and I was working for a corporate system that was just taking all this money, and I said, you know what, here I am, delivering excellent care, okay, to this patient who is in a dire emotional situation, and nobody's here helping me. It's me and a computer, okay? It's just me and a computer and my wisdom helping out this patient in an empty shell of a building. There's no other services here for me. I can do this anywhere, and I can, okay? One of the biggest things about the 2020 COVID revolution, if you will, is at least telehealth was useful. Okay, the ability to connect with providers. There's a lot of rules with Medicare, Medicaid, different insurers, and not covering telehealth visits. They refused for a long time because they wanted every single 91-year-old to come break their hip in the office coming in instead of doing a televisit from home when they have a UTI. This is what we wanted, okay? In 2020, 2021, a lot of these things change. We can telehealth. I can, within 10 seconds, call any one of my patients. I can have my face in front of their face looking at that zit on their butt if that's what we have to do, okay? Or that weird rash, okay? It's not that hard, okay? We need to keep up with the times. This current system is not going to keep up with things, okay? And then I started to feel like patients, my patients, I'm from a small town in Kansas. I'm from Baser, Kansas, okay?
Oh, yeah.
I know every single person in that town, more or less, okay? If you work in a large hospital group system, you never see this person again, that's fine. But I'm accountable for my decisions. I'm accountable for my outcomes in the grocery store the next day. Okay, I know these people. This is my Sunday school teacher. Okay, this is my college physics professor. Okay, these are different things that people that are important to me. That's my neighbor. Okay, so when we have this objective relationship, a financial relationship between an insurer, a transaction, a hospital-based system, that's not there. But when it's people in your community that you're taking care of, you have a different standard. And I think that person-to-person, interpersonal relationship of medicine is missing. Okay, there used to be a medicine man, a shaman,
Right.
a person who was a counselor, a spiritual leader, and a medicine provider. They held all the medicines on their body. They took every single medicine they ever prescribed to anybody, and they knew exactly how every single medicine worked. It was personalized directive care to an individual, and it was put in the context of societal and spiritual factors. Okay, and so much of that is missing. We're getting a little bit of that when it comes to hospice, when it comes to palliative care, when it comes to psychedelic medicine, but nowhere where it's been throughout time. Because at the end of the day, death is inevitable. Infirmity is inevitable. We are slowly decaying, okay, no matter what, okay, and so a few different things. So we've always had this decay over time. How we approach health, how we approach treatments has been dramatically different across many different cultures, across millennia, and it will be in the future, okay? So we have shifting paradigms about what healthcare means, our healthcare delivery systems, and what's missing right now is that interpersonal care from doctor or provider to the patient saying, I care about you, I know who you are, I love you, I
It's
want you to be better.
personalized.
Yeah. When do we lose that?
Right.
Okay. I can't imagine practicing medicine where I don't love my patient. Okay. I can't imagine practicing where I can't give them a hug. I don't like that relationship. I need to be in a place where I love them. They appreciate what I have to say. I'm looking out for their well-being. They trust my advice, or they trust my ability to find different advice, at
Right.
least. Okay.
Well, and if you don't trust your doctor, you're not going to be honest.
Right.
So
Yeah.
if you don't have the full picture
Yeah.
from the patient's, explanation as to what's happening, then, I think your level of service would be somewhat stunted.
Yeah, and let's talk about like the traditional Western model. I come from a lineage, because I like plant medicines and different traditions, but I come from a lineage of Western teachers, okay? Western shamans, Western plant medicine doctors, these pharmaceutical, the Germans, okay? The Iranians and Persians, okay? Thousands of years. Western medicine is the shit, okay? It does work, okay? There's a lot of knowledge about how to heal, about how to take care of people, how we can help people in the Western medical tradition. It's just been distorted right now, okay? But all that knowledge is there. There's also an extensive knowledge that I've learned in my personal life from meditation gurus, yoga teachers, Catholic priests, okay, shamans, breathwork facilitators from around the world, okay? So there's a lot of knowledge out there. There's a lot of knowledge in the Western tradition. There's also complementary and alternative knowledge that we can add into it, and we need to start bringing that all together, and that's really what integrative medicine is, okay? Bringing all those things in, realizing that we're not just a cogwheel in the system, realizing that we have spiritual beliefs, we have different perspectives, hey, we have different genders, we have different races, we have different personalities, we have different incomes, we have all kinds of different things that make us different. We have to have worldviews that encompass this, okay? It's not a one-size-fits-all solution. It's not one pill every day for everybody. There's different things. That being said, there's a lot of concern about the overuse of pharmaceuticals, okay? And so I will say, so I'm the bad guy, okay? Right now, I'm a hippie, okay? But in the medical office with my white coat, which I can put on if we need to, okay? Then all of a sudden, I'm the bad guy. You'll see me prescribing trade name pharmaceutical drugs, okay? And I believe in it strongly, okay? Antidepressants save lives. Antidepressants save lives. How many times do I have to say, I have saved so many lives with the antidepressants, okay? Now there's lots of, we'll talk about that a little bit later. Okay.
I'm
Yeah,
like,
antidepressants. Okay.
"Oh."
Okay. And let's talk about some other things. Okay. Let's say your hand is falling off. Okay. It got slammed in a car accident, and it's falling off. My God, don't take me to the sound healer.
Right,
Okay?
I'm
Don't-
going to the
don't-
ER
Don't
for
take me
that.
to the meditation. Okay, take me to the freaking ER. Give me a medical doctor from whatever institute, make him obtuse. Okay, make him get paid. Whatever. I just please attach my hand. Okay, yeah, please, let's do that. Let's say your baby is breech. Okay, you know who likes a dead baby? Nobody.
Right.
Nobody. Okay, having an emergency C-section, okay, with an anesthesiologist and a trained OBGYN with the ability to save the mother's life and save the baby's life, that's good stuff. I don't want to live in a society where a breech baby dies. Nobody likes a dead baby.
Right.
Okay, so this is an important system. Okay, if I have a kidney stone and I have severe pain and I feel like my side's being ripped open and there is a large kidney stone being stuck in my kidney, I want a urologist to go up my penis and retrieve the kidney stone. As artificial as it seems, I want them to give me hydrocodone, please, before they do it. I want an opiate. Okay,
Yeah.
I also want an antibiotic. Oh, I want a strong one that kills off all my normal gut flora. Kill it all, because right now I'm infected and I'm gonna die in the next day or two if I don't get that emergency treatment. So those are important things. Those are emergencies, and that's where the traditional Western model is very useful. It's not my specialty though. I'm in chronic care, chronic disease management, and primary care, how these diseases interact with our lifestyle. Okay, so we have this ramped up system of very, very professional specialists who can do anything. Okay, they can do anything and everything. Okay, we have these amazing, shiny hospitals. Okay, but they have to be fed. Just like the military industrial complex needs bombs to bomb other countries, Boeing needs to keep making planes, Northrop needs to keep on making radar guided missiles, otherwise there's no profit and we aren't ready for war. The same thing goes on in the healthcare system. We have to keep these doors rolling, okay? These surgeons have to do surgeries, okay? These medications have to be used if they're available, okay? And then that creates all kinds of weird conflicts of interest, okay? Where we had this super hyped up emergency care system, okay? And then we have the ability to maintain it, okay? How do we maintain it when it's not being used?
Right.
Or the other side of it, an interesting thing when it comes to policy is the EMTALA, okay? EMTALA Act requires anybody, I believe it's 500 yards, within 500 yards of a medical facility to receive a free medical evaluation, okay? It does not matter what, as in if you're dying of a heart attack and you roll up to my office, it's my legal obligation to take care of you. I don't check to see if you have insurance first.
Right.
Okay? I don't check to see if you have $20 in your pocket. I save your life first. Okay, I'm required to by law within 500 yards. Okay, so we have these hospitals and these.
501.
Yeah, right. Yeah, it's like, can you fall that way?
Yeah.
No, and trust me, I've been in this situation where I've actually analyzed: is that person drunk on our property, or are they 500 yards away? There's things to that, okay? There's something to that. So then we have different people coming in the system with no ability to pay, okay? And that's not necessarily bad, okay? But we mandate care for these people, and there's no back end. How do we pay for this mandated care? There's no fund for that, okay? All there is a legal mandate that you have to take care of everybody without charging for it. How does that system work too? When you're providing more and more and more levels of free care, okay, that's required by law, but there's no mechanism to pay for this at all.
Right.
Well, you take it from everybody else.
Yeah.
Okay, that's what you do. So yeah, in general, trauma, emergency settings, really useful for traditional Western medicine. When we talk about lifestyle, mood, health, wellness, life satisfaction, all these things like that, our interpersonal relationships, that's where we really got to change out of this model. That's what integrative medicine's about, introducing wellness, nutrition, exercise, counseling, alternative practices like acupuncture and chiropractic work. All of these things integrate into a whole unit to make you yourself, okay, and help address what needs to be healing. The World Health Organization, okay, has a definition about what health is. Okay, it's different from what we think it is in the United States. Okay, health is a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. Okay, so in the United States, we say, hey, you went to the hospital, you're healthy since you came out. You say, no, I just got my pneumonia treated. Okay, it doesn't mean I'm healthy. I'm not in a complete state of physical, mental, and social well-being, am I? I'm just not pneumonia.
Right.
Okay, right? So here we are, we say, oh, doctor, you did such an amazing job. We saved lives. Look, you have not pneumonia. Okay, great. Okay, great. Okay, what about the rest of life? Okay,
Right.
yeah, and things like that. So that's not what healthcare is. That's not what health is. That's just treating pneumonia. Okay,
Right.
but that's not what our health is. And so that's something I like to think about, is how do we promote health in this comprehensive integrative fashion.
And like the mind, body, spirit,
Oh, you better believe it.
interconnected, because they all are related. You know that like an emotional pain tends to manifest in the body physically first. We'll start feeling something. Well, that's, just that.
Well,
Energy.
It's interesting you say that. So, for instance, I treat a lot of back pain. I'm a primary care doctor, okay? Back pain, and I work in a blue-collar area. There's a lot of guys throwing out their back.
Sure.
Okay, right? And so with this, we talk about the traditional Western model. Hey, if this is not getting better in 6 to 8 weeks, we may need to consider an MRI or an X-ray, okay? Here's some anti-inflammatory medicines. Here's some muscle relaxers. I go out, here's my favorite yoga positions. Here's how I can help you, stretch these areas, elongate the fibers. Here's some different things we can do, okay? And then at the very end, what I say is, have you ever considered that your low back hurts in life because you're carrying too much weight on your shoulders? Okay. So generally when people are depressed, I've noticed a strong correlation between low back pain. And I like to think that they're carrying too much weight, they're depressed, they're crunched over, and there's no opportunity for their low back to have any relief at all. Okay? Same thing for this. I talk to people on the neck. I talk about cervical radiculopathy, your C1 through C7 nerves, how they go down through your hand, how we can do all this nerve testing with EMGs. I have steroids that I like to use. I give shots in the butt to reduce the inflammation. It works, okay? We have range of motion exercises. We have muscle relaxers. We have tramadol. We have opiates. We have all these options. But then I like to say, hey, your neck's been hurting you for a while, and we talked about some different things today going on in your life. You ever think that your neck hurts a little bit in life because you spend too much time looking behind you?
Yeah.
Right? And then yeah, that's exactly it. Okay.
Yeah.
So there is some weird spirituality. There's a place for that, okay, and the Western model. And I think there also comes down to trusting your provider when we're getting into the hippy dippy. But there's so much to that. Yeah. And as you said, when physical manifestations come from spiritual and emotional disease, it's a real thing. Okay.
Yeah.
Another good story, for instance, I was in residency and I was dealing with a mother, okay, and she was having severe chest pain. She had been to the emergency room. She had ruled out for myocardial infarction, negative troponins, negative ST changes on the EKG, so on and so forth. She had
Now he's talking about a heart attack.
I can get fancy if we want to be fancy. I have doctor words, And so she had negative workup for a heart attack, okay? And then she had echocardiogram just to assess it. So I'm sitting with her, I'm talking to her. Her child is at Children's Mercy and has heart failure, okay? And is getting ready to have a cardiac transplant, or valve transplant, sorry. And so I'm talking to her, and this whole time she hasn't realized that maybe her heart's hurting because her daughter is getting ready to have a heart surgery, okay? And that maybe that it's her fear and love center, her heart chakra, that's actually firing up, and not so much a lack of oxygenation due to myocardial perfusion through the left ventricle and so on and so forth. There's more to it, and these are real things. I study Ashtanga yoga, okay? And they believe that there are 72,000 nadis through the body, 72,000 channels in which your chi, which your prana, which your energy can flow, mostly directed through the central chakras, okay, root through crown and things like that. But 72,000, I don't even know how you add those up. I don't know how to do that. But yeah, these things are real, and they've been noted for thousands of years. Before we knew about accurate anatomy on these things, we knew about spiritual channels and energy centers in the body. So
I mean, that's been around for thousands of years.
Mm-hmm.
And, you look at a lot of these other cultures that kind of abide or ascribe to the spiritual nature and the physical, and they're living pretty healthily.
Yeah. It's funny. I was just in India, and I like to go to pharmacies in different countries. Okay, it's just one of my things. Okay, you should see me in Mexico. I'm like, I can buy all these things. So now I have a full DEA license and my own direct primary care clinic, so I can buy anything now I want.
Sure.
What I need. But I really like that. So I want to say, what are all these pharmaceuticals that the Indians are using? They have 1.2 billion people between India and China. That's half the world.
Right.
Okay, let's think about that. So what does half the world use for their medical care? Not a lot. They don't have any pharmaceuticals. I could not find pharmaceuticals anywhere. Okay, I'm sure if I looked hard, I could have found an antibiotic or an antifungal somewhere. I'm sure I could have found a steroid. I didn't find anything. I found lots of shampoos. I found lots of soaps. I found lots of cleanses. I found lots of supplements, but I just didn't find it. In Hindu thought, there's nothing wrong with the body that can't fix itself. Mm-hmm. Okay, I don't know how I feel about that all the way, from being a
Right.
jab stabbing Western doctor, okay, and things like that. But it's also an acceptance of what disease is. Okay, of how we approach disease. Okay, we want a remedy, we want a cure, we want an immediate solution to this state. Okay, in fact, that's what we've done with society on a whole. We've taken the most uncomfortable parts of society, okay, death, dying, disease, depression, suicidality, all these negative, dark things, and we package them up so we don't have to think about it. Say that happens in the hospital. Okay, that happens there. We have this unique system where you take this pill, make it go away. We suppress all these things. We don't think about it. I'm sorry, that's not what we're supposed to be doing in life. We're supposed to be exploring things. We're spiritual beings having a human experience. We came here for the suffering. We came here for the disease. We came here for that conflict. To assume that we shouldn't be exploring it, that we shouldn't be diving into our psyche and exploring what's going on, that's balderdash.
Right.
That's what we're here for.
Well, and I like to kind of think of it as like, your energy centers is like a drain, a sink with a drain, and something comes up and you shove it down and you don't think about it. Next thing you know, it's blocked and nothing is working, and so it is important to focus on your spiritual and mental wellness.
You better believe it, baby.
Yeah.
You better believe it.
You know what I was thinking when we were talking about the mother whose heart, she was having problems with her heart, and I was thinking about like a breakup, like truly, or losing, grief, like when you physically can feel your heart breaking.
Yeah.
Like,
yeah.
If that's not an indication of the mind-body connection, I don't know what is.
Yeah, it's so interesting to fear, love, and shame existing on the heart. Okay, and how much we have suppressed shame and suppressed fear in our heart chakra. Man, you can just feel it sometimes, and I felt that before in my most recent breakup. I felt the ripping of my heart, and just breaking into, and I said, my chest will never be the same.
It's brutal.
Yeah, it's brutal.
It's interesting because, I do Reiki and chakra balancing, and I've noticed with the majority of my clients, their heart is blocked, so I get that. I noticed and heard that some of your credentials involved ketamine and MAPS, which is
Rick Doblin.
I don't know him personally, but I do know of him. And he's been a big pioneer and pusher for MDMA and combat veterans and.
Yeah. I mean, different places I've studied. I studied at the California Institute of Integral Studies. It is, I would say it's the Harvard of psychedelics, but it's not. It's the place that trains people for Harvard. Okay, it's the original real deal psychedelic training program. I've also traded with the Prati Institute in Colorado. Okay, they're a phenomenal group, really focused on ketamine. They're changing the system, okay, especially with psilocybin legality in Denver area. There's a lot happening there. There's a lot happening in Oregon right now. There's a lot going on. We're in the middle of a spiritual revolution. Okay, we are. Okay, the way things were in the past will not be the way things are in the future. Done. Okay, we have entire generations who won't understand what the future is like. More or less, anybody who's over the age of 60 has no idea how they're going to participate in society within the next 10 or 15 years.
Sure.
Okay? We're having changed societies. We're really changing. We're really changing. So let me flash back from my first experience in plant medicine.
Yeah.
Okay? Let's go to 2012. Okay, we're on the equator, 13,000 feet, in a hut with a shaman, with 16 other medical students in a university-sanctioned event that the university did not know it was sanctioned at the time. Here, with a shaman who only spoke Quechua, I was feeling pretty good because I could speak Spanish. We are vomiting and having diarrhea and imbibing ayahuasca, which is a combination of two hallucinogenic plant vines, an MAOI inhibitor and a serotonin-based vine. I had previously studied the 8 years before then, learning every single mechanism of the human body. I could tell you about neuroplasticity. I could tell you every single anatomical curve and lump on the body. I could tell you every single research study and pharmaceutical drug. But it wasn't until that moment that I had my eyes opened about what the universe and the world actually is. I learned more in one psychedelic, my very first psychedelic session in Ecuador with a shaman. Okay, I learned more that night almost than I had in the previous 8 years of undergraduate and medical training.
Wow.
It changed my life. I saw the reality and the fabric of what our world exists. I learned from a shaman. Granted, it was a different language. One of my friends was having a very There are no bad experiences, only
Right.
challenging experiences. You have a very challenging experience as a monkey. And I learned how to heal from an ancient tradition, okay? How to calm the body, how to work the energy, how to deal with these thoughts that didn't seem natural, and how to put it all in perspective. It changed my life. And so I sat with that for many years, okay, and never having another experience. And then about in the late 20-teens, I went back to it, especially around the time of COVID. Had another experience there, and it brought me right back in. After 5 or 6 years, no interactions with psychedelic states, I was brought right back into it. I really feel like it's my calling to help spread this knowledge and to help spread this basis of spirituality.
Yeah, I agree. It's been a game changer for me. I started my journey maybe 6, 7 years ago. And, little by little, I definitely will feel called to certain medicines. And, sometimes I don't. And usually I have to question why I don't. And,
Yeah, I mean, for me, as a Western medical provider, I have a DEA license. I've only participated in legally sanctioned activities in other countries where it's legal activity or a sanctioned ketamine activity, if you will, in the United States. And so for me, it's important to keep the legality completely in focus because that's what we are talking about with these FDA studies and things like that. Let's talk about different psychedelics first. There's traditional and non-traditional psychedelics, okay? Traditional psychedelics come from plant medicine traditions, okay? Ayahuasca, okay? Yahe, very similar, okay? Peyote, okay? A cactus, all right? Mescaline, derivative of that, all right? Psilocybin mushrooms, okay? And then we can also get into things like salvia, DMT coming from plant and animal toad sources, okay? These are our ibogaine, okay? Plant in Africa. These are our natural psychedelic medicines. Then we get into synthetics, okay? LSD from the 50s and 60s, okay? We get into MDMA coming into the 80s and 90s. And then now there's a whole boatload. I don't even know the names and names of all these derivatives of synthetic psychedelic medicines. And then there's this other category, which is ketamine, which everybody likes to argue about whether it's truly a sedative or a psychedelic or what it's doing. I'm going to say it is a psychedelic medicine, and I'm going to stick with that because I have seen profound results from ketamine treatments in the past.
So when you have a client or a patient that comes in, and what do they present with where you would suggest ketamine as an option?
Yeah, I mean, I think the easiest one, and we have indications for this FDA, is treatment-resistant depression. Okay, depression that has not responded to other medicines. As I said earlier, I believe strongly in the use of serotonin-based medicines. Are they panacea to solving everything? No. Can they acutely help you out in a depressed state? Yes. Okay, but here's the problem with a medicine like that. Let's say we're talking about Prozac. Okay, which is a great medicine. I've helped out so many people using it. It's a great medicine, but are we supposed to take it 6 months? Do we take it a year? We take it every single day. It's our solution. Oh, you're feeling sad? Oh, you just didn't have your Prozac. Oh, I skipped a dose, okay? Feeling happy. It's not really the answer to everything. So that's a 1 pill per day, okay? Ketamine is fascinating because it has a 6-week treatment program and you have lifelong results. Lifelong results. I can't take Prozac for a day and have a lifelong result.
Right.
But I can do a single ketamine session, or I can do a single ayahuasca journey, or I can have a psychedelic-assisted psilocybin journey, and it can change the entire course of my life. A lot of these medicines too have been around for thousands of years, okay? They have accepted uses, there are accepted traditions, there are songs, there are prayers, there are circles, there are ways of actually using these medicines, okay? And they don't necessarily fit into our modern society the way we treat medicine, okay? So I give a pill. I saw patients this morning, I prescribed a lot of pills, okay, today. Usually they're once or twice a day, okay? They're made by a pharmaceutical country, not in this country, okay? They're bought and paid for by insurance companies, and it's monitored. Let's talk about plant medicines, okay? Majority of them are parts of animals or plants, okay? They come in wildly different concentrations, okay? They have wildly different bioavailabilities. You can't quantify 2 chunks or a mouthful or a half cup on a bottle, okay? There's different purity, there's different shelf lives, okay? There's different sources of it, and it could be contaminated. There's also no way to scale that one mushroom that one guy grew, and then
Right.
You can't scale that to millions of people, okay? And they also have harsh side effects, like potentially psychosis, shitting yourself, okay? Vomiting up everything, and intense emotional processes that regular Western providers are not prepared for. So that's why we can't adopt it. There's no safety profile for a lot of these medicines. I can't tell you how to safely imbibe ayahuasca at home, okay?
Right.
Nor would I want to.
Right.
Okay. And the other thing that's missing from all these too is the complete set and setting. Okay. Like as I mentioned before, when we're talking about traditions going on thousands of years, those are set in a societal context about healers and people in society. Okay. These are interpersonal relationships that people have, and this healing is important for society. Okay. So when we're thinking about all these things, it's a different model, okay? It's a different medicine. It's a different mechanism. And I can even talk about some of my work here. For example, I worked on a trial on 5-MeO-DMT, which is hallucinogenic toad venom, phase 1 and phase 2 FDA trials. So I'm not allowed to talk about all the data of this for confidentiality reasons, okay, and for proprietary reasons. But we started people off in a traditional center. Let's talk about a randomized control trial, okay?
Okay.
Blindfolds, okay? In a recliner, playing music, which is pumped in on headphones. This is the standard, okay? It's been across Harvard, Johns Hopkins, all these clinical trials. We all have the same standards. When we're talking about set and setting, it's not doing a Fish concert. Somebody gave you mushrooms. That's a bad
It's not recreational.
setup. Yeah, we're not doing that stuff, okay? We're talking about trained professionals, okay? So in an FDA trial, which I was doing a couple of years ago, then we have 8 people in a room. Okay, 8 people watching this one person under the influence of a psychedelic medicine. There are 2 trained psychedelic therapists, 2 of them with credentials you wouldn't believe. Okay, we have people intensely focused on the outcome of this process. Okay, so when I started lower doses, that was great. Okay, I felt really great about these. We're taking psychedelic naive people who've never practiced wellness or meditation at all, and they're having some mystical experiences. Okay. And then I started to get more and more conflicted as we went through the research. We started trying different doses and higher doses. And I'm not allowed to talk about it completely, but let's just say people started having different reactions at higher levels of dosages. I started feeling uncomfortable about this. I said, what if my research that I'm contributing to shows how effective these medicines actually are? What if I show actually the truth that 5-MeO-DMT probably cures depression over half of people? It's far more effective than 2 or 3% placebo effect from these other medicines that we're getting. What if I show that psilocybin is the most effective medicine? Well, we're going to have a 19-year-old who's suicidal, okay, having a mental breakdown. They're going to come into an emergency room, and the latest research from some stooge doctor, okay, who has no concern about this person whatsoever, says that this 5-MeO-DMT injection is going to be the standard of care. And we're going to blast this 19-year-old off while they're chained to a bed in an emergency room with padded walls, and we're going to call that therapy? Not in my book. I don't want to contribute to that research. I do not want to see psychedelic medicines as mainstream pharmaceutical treatments because our system is not prepared for it. Our paradigm is off. Our Western doctors don't know how to handle emotional and spiritual states. Okay? For instance, while I was in a trial, we were talking about chest pain earlier. Okay, yeah. We had a patient who was talking about their heart was going to explode. They said, "Oh, my heart, I just feel it all. I just feel it all. It's going to explode. Make it stop. Make it stop." All right. Now, you being a Reiki provider, you can tell me what's going on. They're experiencing grief and, and things like that. Well, officially on the clinical trial report, chest pain. Okay. This person would have required a heart catheterization potentially. Okay. If we're following the things. They said their heart was bursting. It was the worst chest pain of their life. They're going to die. That's what they said on paper, okay? Yeah, and things like that. So what you need in that setting is actually a psychedelic therapist or a trained counselor. Somebody can say, I understand you're going through a lot of grief. I understand you're having a lot of emotion. You want to talk about what's going on with your heart right now? Okay, or somebody to gently, in a Reiki sense, press their hand above or on that heart chakra center to help relieve and unblock this area. So here we are reporting side effects from these medicines. Chest pain, delirium. It's like, all these different things. And really, it's a lack of understanding for what these symptoms are actually presenting as. Okay. So I think we have to be really careful about the medicalization of these medicines because our medical system is off. It's not that there's anything wrong with these medicines. Okay. It's that our medical system, the providers, our systems are not responsible for the outcomes. And we should not be uncorking Pandora's box. We should not be uncorking the infinitudes and infinity people's past traumas in an inappropriate setting. You have to be accountable for the results that you bring up. When you bring up a psychedelic state, you bring up past traumas, you can't just lightly skirt around it and you can't dismiss it. These are real things. These are important things. And these are what we came to Earth to experience. Yeah. These are real important things. So you can't dismiss the responsibility when you enter the psychedelic state take somebody there, especially if they're psychedelically naive, you have a responsibility to guide them back out and become whole again. Okay,
Right.
and our system is not set up for that.
Well, and I think back also to like integration and like pre and post integration and how fundamental that is to getting the most out of your experience.
Yeah, so let's say ketamine treatment. The neuroplasticity, which is the ability of neurons to create new networks, is highest at 36 to 72 hours after treatment. Okay, I had an about 5 or 6 years ago. I was not feeling well, lots of social changes. I discovered a ketamine treatment at that time. Okay, I was in a room by myself with an IV treatment, and nobody talked to me. Okay,
Right.
I didn't get to integrate it. Okay, at one point I had a rapid heart rate, and the nurse that was there said, "I'm gonna have to report this." Okay.
Yeah.
Okay. And things like that. But I didn't get to integrate that material and information that came up. I didn't get to do anything with it, and that's a problem. That was a medical doctor. That was a me. Okay.
Right.
That was a Dr. Lillig going out, administering a treatment, charging lots of money, and not being accountable for the results, not being accountable for the spirituality. The most interesting thing too with let's say the MAP studies and the FDA pushes in phase 3 studies for psychedelic-assisted therapy with concomitant psychedelic-assisted. Sorry, let me say that again. Psychedelic-assisted therapy with MDMA. Okay. Together. That was what was interesting about this last year's MAPS approval with the FDA. It got turned down.
I
Okay,
know,
right?
dude.
It got turned down. They said, you know what, therapists are not drugs. Yeah, okay. Yeah, but it's an interesting paradigm because you can't just introduce MDMA. Okay, it's a club drug.
Right.
To people randomly. You need to have therapy with it. You need to have accountability in the system. We need to have counseling. We need to talk about what comes up. We need to have integration before and after. We have to be appropriate stewards of the psychedelic state. It's easy to say, decriminalize everything, give mushrooms to everybody. Okay, yeah.
Put it in the
Okay,
tap
yeah,
water.
put the ass in the water. No. Okay, no.
It's not for everyone.
It's not or maybe it's for, maybe these people haven't experienced significant, difficult psychedelic experiences.
True.
These are real things. Okay, and so yeah, are we good stewards of the psychedelic state? That's what I think we're asking. Overall, I've come. I don't believe in the medical model anymore. I worked on that model for a long time. I've spent years of my life and training. Like I said, I went to the highest institutions for the medical model of psychedelic administration. I will be, continuing to do ketamine therapy in the future, but I don't believe in these aggressive psychedelic medicines. They uncork too much. Okay, ketamine's nice because it's a sedative. Okay, it's an anxiolytic. Okay, let's say psilocybin, it can be really activating. The tryptamine content, it really can uncork the whole universe all at once onto you, and there's no way to process that. Okay,
Right.
yeah, especially if you're naive to these situations. Whereas ketamine's a gentle giant. It kind of comes in, shows you some things, okay, but it keeps the anxiety down, it keeps the agitation of the body down because it's a literal dissociative sedative, okay, and it opens neuroplasticity. Okay, we're talking about mTOR pathways, glutaminergic pathways, brain neurotrophic derived factor, BNDF pathways. All these things upregulate after ketamine treatment. You find brand new thought patterns. Here's the idea behind neuroplasticity, okay? Neurons that fire together, wire together, okay? Our old thought patterns that we've been doing of, I can't ask her to the date. She thinks I'm stupid and she'll say no. I can't ask her to the date. Okay, so we have this thought pattern. It's going over and over and over. The loop. Perseveration in psychiatry, over and over and over again. The more and more we go through that loop, the more and more strong it becomes. Neurons that fire together, wire together. So we have these strong, entrenched neural networks that tell us false things that aren't really true. The best thing about our brain, in reality, if you will, is that we can think and create anything. Okay, so when we rework these networks and break them up and all of a sudden create new extensions, new dendrites, and new neurons and new connectivity, we open up the world of possibility. I love it. I love it. We get rid of these hardwired patterns.
Yeah. Well, and I think psychedelics are amazing for that very thing. I think of the book, How to Change Your Mind, and how he talks about, the ski mountain and the slow, people going down in their skis down the mountain and creating these, routes, and how you need to, the psychedelic is like the snow falling all over and there's no more tracks and you get to basically create a new path.
Yeah, I love it. Yeah. It's all about infinite possibility of our mind. And, it's interesting too. There's some research or some thought that basically children are in a constant, persistent psychedelic state. Okay, and that their world is open, and that we don't appreciate that psychedelic state. We're too distant from it. Okay, so the second when you start to learn that you gotta pay $1 to enter the bus, that squares have 4 corners, that a circle is round, that grapes taste good or bad, we start putting all these terms on things. The second we name God, okay, we start to limit the ability of God. So we had this whole experience where we start teaching a child that this is the way it is. This is what reality is. This is how things work. Now, if they're brought up in a different setting, a different reality, maybe a different dimension, they might have a completely different experience, but the same brain, okay? So we're tailing this child, this is the way it is. And over time, the persistence, year after year, decade after decade, we all start to think similarly. Mm-hmm. But it didn't have to be that way. There's all kinds of opportunity out there. There's all kinds of thought processes and potentiality, and we're not even using our brain to nearly the power that it can be. I think in the future, we're going to find new ways to uncork the full potential of our brain.
Wouldn't that be something?
Woo, it's coming. So
I'd love to know any of like the juicy little nuggets of like research information you may have. Anything you'd like to share?
Well, yeah, I mean, through the history of psychedelic research, okay, yeah, well, I'm not allowed to share all the details. It's ongoing research, and I'm restricted from sharing that detail. The original study, 1962, Good Friday, Boston University, 20 graduate students, psilocybin in a church on Good Friday, okay? And they found out, this is Timothy Leary and Richard Alpert. Tim Leary, who you may know, Richard Alpert, who is Ram Dass, okay, administering this double-blind study with niacin and psilocybin, profound religious experiences, okay? And we had all these substances available in the 50s and 60s, and then Nixon, and they got blacklisted, okay? And it wasn't again until 2006 where you have Roland Griffiths, Johns Hopkins University, Mary Casamano, is one of my mentors, doing this research. And in 2006, they released a study, huge study. We found that over half the participants put that psychedelic experience as their top 5 life experience, okay? Quantifiably measurable improvement in long-term life happiness, and 96.1% of people, that's a lot of people, had a mystical experience. A mystical experience being qualified as unity, sacredness, intuitive knowledge, transcendence of time and space, ineffability, and enhanced mood. 96, as in there's no mistake. These medicines have an effect.
Yeah.
Yeah, and it's significant.
Yeah, well, I mean, I can think of my own personal experiences with all of them over the years, and they are profound. They are life-changing. Now, they're not the magic bullet. They're a tool that you can use, but in conjunction with a lot of other things. You can get all these beautiful
Psychedelics are not a panacea, okay? If I have a UTI, I don't need mushrooms for it, okay? Right. I need an antibiotic, okay? And things like that. And there's also a danger, too, from people in spiritual communities who overuse psychedelic medicines. Factually, psychedelic medicines are not addictive, okay? And there's lots of studies show that they are not addictive, okay? And in fact, if you put animals and rats, they choose not to have these medicines. The problem comes from the euphoria of a psychedelic experience and that experience with God, okay? People want to go back to it, okay? And they want to be in that place of eternal love and acceptance and understanding. They don't want to do the dishes, okay? So we want to have these experiences where we understand the infinitudes of infinity, but yet we don't integrate it into our day-to-day life. I'm a strong believer that these spiritual experiences help us live better. It's not about the experience itself. It's about your actual life, how you're integrating this information and knowledge and using it in your real world. If you never take that time to integrate and reflect on what's going on in your life, what you learned from God, then you're not doing your job in the psychedelic session.
Yeah, I mean, I think back to last April, I was in Costa Rica on an ayahuasca retreat, and the very last day, I get news that one of my dearest, longest friends had died from a fentanyl overdose. And so it was like I didn't get any of that like extended bliss or like it was a really rough integration. Mm-hmm. And, I definitely could have used a lot more support than what I had going through it. So I can see how that would be impactful.
Yeah, it's important too when you're in a psychedelic state to be with an actual psychedelic therapist. Like, for instance, I'm going to the Grand Canyon, okay? I want to explore the Grand Canyon. I hope that my tour guide has been to the Grand Canyon before.
Right.
It sounds silly, okay?
Right.
But we have different therapists and different people trying to counsel and lecture and help people with these kind of difficult experiences who have no training, no ability to actually help. So that's important to actually get yourself in the right set and setting with those people. And so, very important.
Yeah.
The other thing, too, that we're finding with psychedelics, with traditional therapy, is that psychedelic medicines, MDMA, psilocybin, ketamine, actually augment the process of psychotherapy. They make it go faster, okay?
Right.
A lot of times people will claim, hey, in my one psychedelic session, I had 10 years worth of psychotherapy in one dose. And so we're finding it's not about replacing clinical psychology or personal work. It's about helping it go faster through enhanced insight.
Well, and it also opens you up. I think of MDMA and how, people who otherwise might not speak about their trauma, they take MDMA and they're able to, without that visceral reaction, they're able to share about
the
it.
MAPS training, the evidence behind couples-based cognitive behavioral therapy, couples-based therapy and systems units with MDMA is profound. Okay, it's profound. It's all there. Okay, we know that if you do couples therapy with MDMA, you're going to have better success rates than if you didn't. It's about the legality of it. Okay, and apparently taking ecstasy and talking about your interpersonal traumas is maybe not for everybody too. It looks a little bad on paper, but the evidence is all there. So when we're changing paradigms about what works, we got to follow the research.
Yeah.
The ego thinks that death is real. Don't blame the ego for doing its job. Everybody blames the ego. The ego keeps you around. It keeps you active. It keeps you reproducing. It pays your mortgage for you. It keeps you fed, okay? A lot of psychedelic medicines reduce the ego, okay, and diminish the ego, so we have this state. But we go back into the state of having the ego again. So don't hate your ego. Befriend your ego. Realize it's helping you out in life. And realize that you, in fact, are not your ego. You are, in fact, soul. You are not your body. You are soul. So.
I like that distinction because I think, especially, being in a spiritual community, sometimes the ego is labeled as this big, bad horror. We've got to eradicate it. And the truth is, it has kept us alive, you know?
Love yourself. Okay, love your ego too. Okay,
Right.
love your shadow.
All the parts.
Love all your parts together.
Yeah.
It's all important. And so don't hate the ego. Befriend your ego. Realize what is your ego and what is you, soul. Differentiate the two, and then you can grow.
Yeah. I love that.
A lot of times we need to change our limiting beliefs. For instance, I have a 6-year-old daughter who says, I don't like broccoli. Okay. And so what I do is I coach her a little bit differently. I say, well, you don't like broccoli right now. Okay. So in the future, you might broccoli. I might have an amazing dish that tastes really good. You might mature. You might have different taste buds over time. So I've taken my 6-year-old to say, I don't like broccoli yet. Okay, right. So, and I think that's important for us, okay? We always have these limiting beliefs. I can't, I won't, nothing ever good happens for me, okay? But that's not necessarily the case. Say, it hasn't happened yet. I haven't learned to like this yet. I haven't moved on from this yet. But there's always the field of potentiality. There's always this possibility that we can. So don't give yourself limiting beliefs, okay? Don't limit yourself. Always say, I haven't
The world
done it.
is good enough at doing that to you on its own.
Yeah. It's to say, say, I haven't learned to do this yet. I haven't excelled in this yet.
Yeah, I like that.
Health is a journey, not a destination. Your health is exactly where it is today. Let's talk about weight. Your weight is exactly where your weight is today. Newsflash, if you exercise more and eat less today, tomorrow you will probably weigh a little bit less or down the line, okay? We always compare ourselves to past images of ourselves. Well, I used to weigh 40 pounds less. Well, next year I'm going to do this. Well, I bought this, all these plans, but the reality is your health, your emotional state, everything about your body is exactly where it is right now. If you want to make a change, it comes down to what you're doing today. Okay, so what are you choosing to do today? There'll be a direct impact tomorrow. And then what do you do the day after? And what do you do the day after? Are we creating these trends of positive effects? It's not the destination. It's the journey along the way. So accept yourself exactly where you are for right now, whatever state, mental, physical, emotional, and say, I am where I am. What am I going to do today that's going to change things for tomorrow?
Yeah.
Yeah. So.
Well, Shawn, I want to thank you so much for coming in. You are so prepared. You are the most prepared guest I've ever had. It's been amazing. And there's still so much more I would love to talk to you about. But I just really appreciate you taking time out of your busy day to come share your knowledge.
Yeah, thanks for this platform. Okay, I hope the knowledge created from this can change lives. I hope people take it to heart. I hope people are learning from this information. And a lot of these things are things I've written down from my research and different states. Okay, so a lot of these things came from across the veil. I think it's important to write down your thoughts, your profound thoughts when you have them, and so that way they can be shared with the world.
Oh, I love that. Well, thank you again. It was so lovely to meet you.